Make Tortwell your study buddy to learn anytime, anywhere without carrying a load of books with you. Sign up now and get a free trial.
Let's talk about dentinogenesis today, the process where dentin, the hard tissue that forms the bulk of our teeth, is created. The process of forming dentin in teeth starts at the highest points of the tooth's cusps. Odontoblasts, which are specialized cells responsible for dentin formation, first undergo differentiation, a process where they mature into functional odontoblasts. Once matured, these cells start producing collagen, a crucial protein that forms the initial framework or matrix for dentin formation. This process marks the beginning of dentinogenesis. When odontoblasts, the cells responsible for forming dentin in our teeth, are developing, they rely on certain substances and signals to guide their growth and function. Think of these substances like ingredients in a recipe or tools in a workshop that help odontoblasts do their job effectively. Firstly, substances like fibronectin, decorin, laminin, and chondroitin sulfate act as helpers or assistants. They play important roles in supporting the transformation of odontoblasts into mature cells capable of producing dentin. Among these, laminin alpha-2, a part of the laminin complex, is particularly crucial. It acts like a supervisor, ensuring that odontoblasts mature correctly and regulate the production of dentin proteins. Secondly, there are growth factors such as TGF, IGF, and BMP. These are naturally occurring substances found in the inner enamel epithelium, a specific layer of cells in developing teeth. These growth factors are released and then absorbed by preodontoblasts, which are precursor cells to odontoblasts. Once absorbed, these growth factors act like power-ups, enhancing the abilities of preodontoblasts to organize their internal structure and perform their role in forming dentin. As odontoblasts evolve, they undergo a fascinating transformation. They change shape from round to columnar, with their nuclei moving to the base. Imagine these cells stretching out, just like a tree growing its branches. These cells grow longer but maintain the same width. Inside the odontoblasts, a substance called proline appears in certain parts of the cell, moves into the processes, and is then released into the extracellular matrix, forming the base of dentin. In the process of forming dentin, there are several important proteins and substances that play crucial roles. Firstly, there's dentin phosphoprotein. This protein binds to calcium and is essential for shaping and controlling the growth of tiny crystals called apatite within the dentin matrix. Think of DPP as a builder who carefully places each brick of apatite crystals in the right spot to strengthen the structure. Next, we have osteonectin and osteopontin. Osteonectin helps regulate crystal growth by slowing it down, which is important for achieving the right balance of hardness and flexibility in dentin. Meanwhile, osteopontin assists in the process of mineralization. Now, here's an interesting twist involving chondroitin sulfate. In the early stages, chondroitin sulfate prevents the premature movement of apatite crystals in a soft, precursor layer called prodentin. This delay ensures that the crystals form at the right pace. However, once the dentin matures and mineralizes, chondroitin sulfate switches roles. It now helps bind the apatite crystals to collagen, the protein framework of dentin. This dual role ensures that dentin develops correctly, with the right amount of mineralization at each stage. Next up are the matrix vesicles. These are crucial for the mineralization of the initial layer of dentin, known as mantle dentin. These vesicles contain special enzymes like alkaline phosphatase. This enzyme helps by increasing the amount of phosphate in the area around the developing dentin. The phosphate combines with calcium from the surroundings to form crystals of hydroxyapatite. This mineral gives dentin its toughness and strength, similar to how bricks make a wall sturdy. So, matrix vesicles act like little factories that kickstart the process of making dentin hard. Nerves, which are usually associated with sensing and transmitting signals in our bodies, also seem to play a part in how dentin forms. Proteins like synapsin and synaptotagmin, which are typically found in nerve cells, have been discovered in the tiny channels of dentin called dentinal tubules. These proteins suggest that nerves might influence how odontoblasts, the cells that make dentin, work. While we're still figuring out exactly how this happens, it's an exciting idea that nerves could have a say in how our teeth grow and repair themselves. Initially, odontoblasts produce about 4 micrometers of dentin daily, which continues until the crown forms and the teeth erupt. After that, the production slows to about 1 micrometer per day. Once root development is complete, dentin formation decreases, although reparative dentin can form quickly after a tooth is restored. Dentinogenesis is a two-phase process. First, a collagen matrix is formed, and then it's calcified. Each layer of predentin takes a day to calcify before the next layer forms. Dentin mineralization begins with the formation of tiny hydroxyapatite crystals. These crystals initially appear as fine plates on collagen fibrils and within a glue-like substance that holds everything together. Over time, crystals form inside the collagen fibrils, aligning parallel to them, which is crucial for dentin strength. As mineralization continues, crystals gather into spherical clusters called spherulites, starting the hardening process. The peritubular region around dentinal tubules quickly mineralizes, creating a strong structure. The crystals in dentin are very small, about 3 nanometers thick and 100 nanometers long, much smaller than those in enamel but chemically the same, hydroxyapatite. Occasionally, chalcopyrite mineralization occurs, adding strength to dentin. Proteins like dentin sialoprotein control mineral deposition, while some proteoglycans in predentin prevent premature hardening. Genes like MAP1B and PHEX are essential for guiding the cells and processes that create dentin. Dentin mineralization transforms a soft matrix into hard dentin using tiny hydroxyapatite crystals. This process is controlled by specific proteins and genes, ensuring dentin forms correctly and stays strong. Now, let's explore how dentin changes with age. These changes include the formation of sclerotic dentin and dead tracts, each playing a distinct role in the aging process of our teeth. Sclerotic dentin forms when hydroxyapatite crystals are deposited in the intertubular dentin and within the dentinal tubules. This process blocks the tubules, preventing the entry of bacteria and other substances. Imagine it as a protective barrier, sealing off the pathways to keep the dentin safe. As these crystals accumulate, the dentin becomes transparent when viewed with transmitted light. This is why sclerotic dentin is often called transparent dentin. The areas of sclerotic dentin become less permeable, meaning fluids and other substances can't easily pass through. However, this increased mineral content also makes these regions harder and more brittle. An important consequence of this brittleness is that the apical thirds of roots in elderly patients can break more easily during tooth extractions. The sclerotic dentin's hardened nature contributes to this fragility, making it a crucial consideration for dental procedures in older adults. Dead tracts are another age-related change in dentin. These are areas where the dentinal tubules have degenerated, often appearing dark when viewed with transmitted light. You can think of dead tracts as abandoned pathways within the dentin where the cellular processes have died off. Dead tracts are commonly found in teeth that have experienced significant wear, such as attrition, tooth-to-tooth wear, or abrasion, wear from external sources like brushing. They are also seen beneath carious lesions, where the decay has progressed and damaged the underlying dentin. Both sclerotic dentin and dead tracts impact dental health and treatments. Sclerotic dentin, while protective, makes the teeth harder and more brittle, posing challenges during extractions. Dead tracts, on the other hand, indicate areas of past damage and degeneration, often associated with wear or decay. Alright, let's recap. Dentinogenesis begins with odontoblasts at the tips of teeth laying down collagen, supported by proteins like fibronectin and growth factors TGF, IGF, and BMP. These factors help odontoblasts transform into columnar cells that produce dentin. Key proteins such as dentin phosphoprotein, osteonectin, and osteopontin guide the formation of hydroxyapatite crystals, which mineralize the collagen matrix into dentin. The mineralization process starts with hydroxyapatite crystals forming on collagen fibrils and then within them, aligning in a structured manner. This mineralization occurs in spherulites and the peritubular region, creating a strong dentin structure. As teeth age, sclerotic dentin forms with dense mineral deposits, making it harder but more brittle, affecting dental procedures. Dead tracts, areas of degenerated dentinal tubules, also develop, indicating past damage. Understanding these processes reveals how dentin forms and changes over time, impacting dental health.